So, good evening po. My name is Gianfranco Biachano, a student nurse from BSN 1B. And for today, I will be talking about heart and neck vessel assessment and skills. So, before I start my return demonstration, I will first be answering the knowledge portion of our return demo. So, first, describe the structure and function of the heart and neck vessels. So, the heart is a hollow muscular organ located in the middle of the thoracic cavity between the lungs in the space called mediastinum. It is about the size of a clenched fist, like this. It is as size as this. It is a powerful muscular organ that pumps blood to all organs and tissues of the body. Neck vessels includes the carotid artery and jugular veins. Assessment of the pulse of these vessels reflects the integrity of the heart muscle. So next, number 2. Discuss the components of the jugular venous pulse wave. So there are 4 components of the jugular venous pulse. First, the A wave. Second, the X descent. Third, the V wave. And fourth, the Y descent. First, the A wave reflects rise in arterial pressure that occurs with atrial contraction. Second, X descent. This reflects right atrial relaxation and descent of the atrial floor during the ventricular systole. Third, the V wave reflects right atrial filling, increased volume, and increased atrial pressure. And lastly, the Y descent reflects right atrial emptying into the right ventricle and decreased atrial pressure. Number 3. And last question. Describe the 2 physical examination techniques used to assess the neck vessels and the techniques used to assess the heart sounds and precordium. So the first physical examination is the inspection. For neck vessel assessment, inspect for jugular venous pulse by standing at the right side of the patient for cardiac assessment. First, take a moment to assess the patient's general appearance. Next, inspect the patient's pericardium, the anterior region of the chest and thorax, including the epigastric area. Note landmarks you can use to describe your findings as well as structures underlying. Second, palpation. Maintain a gentle touch when you palpate so that you won't obscure pulsations or similar findings. Using your fingertips, palpate over the pericardium to find the apical pulse. And lastly, auscultation. In auscultating, begin with warming the stethoscope in your hands like this. This is the stethoscope. Warm it with your palm or just simply with your fingers. And then identify the sites where you'll auscultate. So, first things first, let's head to the preparation. Don't forget to perform the proper hand washing techniques before you start the assessment. And next, gather all the materials needed. In this assessment, I will only be using the stethoscope. And next, explain the procedure to the client. And lastly, ask the client to wear clean gown. So next, we will be assessing the neck vessels. Firstly, we will be inspecting jugular venous pulse. Inspect the jugular pulse by standing on the right side of the client. Client must be positioned in supine position. Look for any inward or outward pulsation, paying particular attention to the apical area, the left sternal border, and the base of the heart in the second right and left. Second, measure jugular venous pressure by watching for distension of the jugular vein. Next, palpate carotid artery for amplitude and contour, the pulse, elasticity of the vessel, and trills. And lastly, auscultate carotid arteries for bruits. Bruit is a murmur-like sound of vascular origin or sound like buzzing of blowing. If you hear a bruit during arterial auscultation, the patient may have occlusive arterial disease or AV fistula. And next, we will be heading to the cardiac examination. First, we will be inspecting. First, take a moment to assess the patient's general appearance. Is he overly thin, obese, alert, anxious? Next, inspect the patient's precordium. The anterior region of the chest and thorax, including the epigastric area. Also look for visible pulsation, symmetry of movement. And next, Next is the palpation. Palpation of the precordium is a very important technique, performed to evaluate the characteristics of the right and left second intercostal space and the epigastric area. Palpation apical pulse. To evaluate apical impulse, to assess dilation and dynamics of RV, aorta, and pulmonary artery. Palpate for abnormal pulsations or vibrations at apex, left sternal border, and base. Auscultate heart sounds for rate and rhythm. Auscultate S1 and S2 heart sounds for sound location, intensity, and duration. Next, we will be auscultating the client in left lateral position and with the client sitting up, leaning forwards and exhaling. Perform the aftercare of the materials. And once again, my name is Gianfranco Villachano, a student nurse from BSN 1D, and that is the Heart and Neck Vessel Assessment. Thank you.